I'm Robin LaCroix, and I'm Chairman of the Department of Pediatrics and Medical Director for Children's Hospital. My practice is Pediatric Infectious Disease, and I have a hospital-based practice seeing children that are admitted to Children's Hospital with different types of infections. So I grew up in Clemson, South Carolina, and went to Clemson for undergraduate, then to the University of South Carolina School of Medicine in Columbia for medical school. Subsequently, did my internship at Chapel Hill in Chapel Hill, North Carolina with the University of North Carolina in pediatrics, and then returned to Greenville for my pediatric residency here at the Prisma Health Children's Hospital. I then practiced with the Children's Clinic for 3 years and then went to the Emory University program for Pediatric Infectious Disease and did my fellowship there in Pediatric Infectious Disease. Was fortunate enough to return to Prisma Health to establish the first Pediatric Infectious Disease division at the Children's Hospital here. So pediatric infectious disease takes care of children really from birth all the way up to age 18. Those are children that have infections or immune compromising disorders. We take care of a wide range of infections as well as collaborating with the other pediatric subspecialists around specialty care for children with more chronic diseases that also intersect either with immune dysfunction or with infections. So I always loved microbiology in both college and in medical school. I loved understanding the different organisms that cause infection, but also understanding the immune system's response to those organisms, and that led me to really pursue the career in pediatric infectious disease. And children, as you know, often have a lot of fortunately viral and fairly benign infections, but understanding those and the impact was really an interest that I wanted to pursue. So I think the biggest part of helping inspire health in patients is helping them understand the why behind what we are either treating in the way that we're recommending the treatment and or particularly around immunizations and why those can help change the trajectory by training the immune system to respond appropriately. So I think really helping families understand both the disease that their child's dealing with, but also to understand the different modalities that are available. And some of those are really evolving very quickly, and having them understand that what we know today, very well there may be new treatments, so that many of the conditions that used to feel lethal or life-limiting no longer are that way. And so helping families have that hope is another piece that I think is really important that we can bring to help them on their journey in coping with a child's illness, which really impacts the entire family. I like to arrange flowers. I like to grow flowers. My husband would say that I do not like to do yard work, but I like to have my flowers that he helps me with the tough parts of planting and maintaining. And I certainly enjoy doing different activities like hiking and traveling with my family. My practice is limited to children that are admitted to the hospital, and so the primary physician caring for that child reaches out to ask for consultation to pediatric infectious disease, and then myself or one of my other 3 partners will see the child, offer our guidance to that primary team about how to manage the child. And then we also have an outpatient practice. I personally am not a part of the outpatient side because of my administrative responsibilities at the hospital, but my partners then can follow those children up either for short-term follow-up or long-term follow-up, depending on what is needed. We're a group of 4 and all pediatric infectious disease trained and board certified.